Diabetes insipidus, it is a disorder of the posterior lobe of the pituitary gland that is characterized by the deficiency of antidiuretic hormone or vasopressin. The decrease in the antidiuretic hormone results in fluid and electrolyte imbalance caused by decreased urine output and increased plasma osmolality. So the diabetes insipidus, it is due to the deficiency of the hormone that is the antidiuretic hormone. So we all know the function of antidiuretic hormone. It is to utilize the water inside our body. It is used to reabsorb the water in our body with the help of the kidneys. Okay, then vasopressin. This is also responsible for decreasing our blood pressure. So the decrease in the antidiuretic hormone, if the antidiuretic hormone is not doing its function, or if there is decrease in the ADS, then the water reabsorption of the water inside our body will not be there. Then electrolyte imbalance will be caused. The causes of diabetes insipidus are like head trauma, if there is any head trauma which may involve the pituitary, and then brain tumor, then surgical ablation or irradiation of the pituitary gland, then infection of the central nervous system like meningitis, encephalitis, and tuberculosis. Metastatic diseases like lymphoma of the breast or lungs, and other causes like renal tubules failure, kidney failure, etc. Then types of diabetes insipidus, there are three types: central, nephrogenic, and gestational. In the central or neurogenic diabetes insipidus, it results from the interference with the antidiuretic synthesis, transport, or release. Example, when there is a brain tumor, head injury, then the pituitary will not be able to synthesize or transport the antidiuretic hormone. Then nephrogenic, when it results from the inadequate renal response to the antidiuretic hormone despite the presence of adequate antidiuretic hormone. Example, drug therapy, renal damage, hereditary, and renal disease. Although the antidiuretic hormone is produced from our pituitary, the water inside our body will get reabsorbed in our kidneys only. So if there is any renal problems like renal failure, renal damage, or hereditary renal disease, the reabsorption will not be done properly. Then in the gestational diabetes insipidus, it is rare and occurs only during pregnancy when the enzyme made by the placenta, the system of blood vessels, and other tissue that allows the exchange of nutrients and waste products between the mother and her baby destroys the ADH in the mother. In the pathophysiology, so due to the etiological factors like head trauma, tumors, and all, there will be decreased antidiuretic hormone. When there is a decreased antidiuretic hormone, there will be decreased water reabsorption in the renal tubules. Then it will cause the intravascular fluid volume, which may lead to increased serum osmolality. That means that there will be hypernatremia. More sodium will be there. Then excessive urine output will also be there. If the body is not able to reabsorb the water, then the urine output will be more. So the signs and symptoms will be like polyuria will be there, polydipsia. Polyuria means excessive urine output. Polydipsia, excessive thirst, then irritability, nocturia, more urine output during the nighttime, then fatigue, sleep disturbance, coma, mental disturbance, weight loss, shock. Then craving of cold water, may experience generalized weakness. Okay, so this all hypernatremia and all these all are the signs and symptoms. In the diagnostic, we'll do the history collection, physical examination, then 24-hour urine collection, then serum electrolytes, sugar test, then urine specific gravity, then plasma antidiuretic hormone level we can do, then MRI, genetic screening. We can also do this water deprivation testing. So before doing this test, We should test. We should weight the body. We should weight the body weight and urine osmolality, volume, and specific gravity. Then the person is deprived of water for 8 to 12 hours. Then after that, desmopressin acetate will be given simultaneously or subcutaneously or nasally. Through the subcutaneous route or through the nasal, this desmopressin will be given. Then after that, patient with central diabetes insipidus will show dramatic increase in the urine osmolality from 100 to 600 and a significant decrease in the urine volume. And the patients who are having the nephrogenic diabetes insipidus will not be able to increase the urine osmolality greater than 300. So these are the diagnostic tests. Next is the management of diabetes insipidus. So in the central diabetes insipidus, it is due to the lack of the antidiuretic hormone, so it is usually done with the help of desmopressin. It can be done as it may be taken by orally, nasally, or by injection. Then if it is due to if the pituitary gland is suppressed due to any tumor which is present inside the brain, then it should be done, it should be treated. Like surgery should be done to evacuate the tumor cell. Then desmopressin should be considered a medication as needed. It is because in most people the deficiency of NTH is not complete and the amount made by the body can vary from day to day. So in mild cases, we only need to increase the water intake. In the nephrogenic diabetes mellitus, desmopressin is not a treatment option. A low salt diet should be given. Then drinking of enough amount of water should be done to avoid the dehydration. Then diuretics like hydrochlorothiazide should be used along with other medications to improve the symptoms. Then in the gestational diabetes, it is also done with the help of the synthetic hormone desmopressin. Okay, so in the primary polydipsia, there is no specific treatment for this form of diabetes other than decreasing the amount of fluid intake. So these are the management of the diabetes insipidus. In nursing management, we can review that then in the complications there will be electrolyte imbalance and dehydration.